Picture this. Your tribe has 12 people. You have lived with all of them your entire life. You know how each one moves, how each one sounds, what each one does when they are afraid or angry or tired. You know them the way you know your own hands. And then one morning, one of them is different. Not sick in a way you can see. No wound, no fever, no broken bone, but something has shifted behind their eyes. They are talking to people who aren't there. They are laughing at nothing. They are standing at the edge of camp, staring at the horizon for hours without moving. They are not sleeping. They are not eating. And when you try to reach them, they look at you like you are the stranger. In 2025, we have a name for what might be happening. We have clinics, psychiatrists, medications, diagnoses, entire systems designed to respond to this exact situation. We have language for it. We have protocols. Your ancestor had none of that. What they had was a person who used to be someone they knew, who was now someone they didn't recognize, and a very small group of people who all depended on each other to stay alive. What happened next is one of the most revealing things in all of human history, because the way a society treats its most vulnerable members tells you everything about what that society actually believes. And what ancient humans believed and did about mental illness is far stranger, far darker, and far more compassionate than you would ever expect. Sometimes all three at once. The first thing to understand is that no ancient culture on Earth had a concept of mental illness as a medical condition. Not one. The idea that the brain is an organ that can malfunction, the way a bone can break or a wound can get infected, simply did not exist for most of human history. What they had instead was a different explanation, and it was universal. Across every ancient culture ever studied, from Mesopotamia to ancient China, from prehistoric Europe to the indigenous peoples of the Americas, the explanation for what we now call mental illness was the same at its core. Something outside the person had entered them, or something inside the person had been taken. A spirit, a demon, an ancestral force, a divine punishment. The specific vocabulary differed from culture to culture. The fundamental framework did not. This matters because it completely changed what you did about it. If a broken bone is a mechanical problem, you set it. If an infection is a bacterial problem, you treat it. But if a person's mind has been invaded by a spirit, if their self has been displaced by something that doesn't belong, then the treatment is not medical. It is spiritual. It is a negotiation with the invisible world. And that is exactly what ancient humans did. The earliest mental health practitioners in human history were not physicians. They were shamans. Healers who operated at the boundary between the visible and invisible worlds, who could communicate with the forces that ordinary people could not see, who knew the rituals, the plants, the songs, the procedures that could negotiate with whatever had taken up residence in a person's mind and convince it or compel it to leave. This is not primitive superstition dressed up in anthropological language. This was a serious, sophisticated, internally consistent system of understanding and treating human suffering. It was the only system available, and in the hands of skilled practitioners. It sometimes worked, not because the spirits were real, but because the ritual, the community response, the attention, the altered states of consciousness produced by certain plants, and the placebo effect of a coherent explanatory framework are all genuinely powerful forces in human psychology. The response to mental illness in the ancient world was not uniform. It ranged from profound tenderness to absolute horror, often within the same culture, depending on what kind of mental illness it appeared to be, what the healer decided was causing it, and whether the person was considered recoverable or permanently lost. Trepanation, the oldest surgical procedure ever discovered in the archaeological record, is not the setting of a bone or the treatment of a wound. It is trepanation, the deliberate drilling or cutting of a hole in a living person's skull. Evidence of trepanation goes back at least 10,000 years, found on every inhabited continent. The Neolithic skulls that show trepanation holes almost always also show evidence of healing, meaning the patient survived the procedure and lived for months or years afterward. The most widely accepted theory for why this was done, particularly in cases without evidence of head trauma, is that it was intended to release whatever spirit or force was trapped inside the skull, causing the person to behave abnormally. You drilled a hole in their head to let the demon out, and people survived it regularly. Plant medicines. Across virtually every ancient culture, specific plants were used to alter consciousness as part of treating mental disturbance. Some of these plants, psilocybin mushrooms, peyote, ayahuasca, cannabis, contain compounds that modern neuroscience has confirmed produce genuine therapeutic effects for certain mental health conditions. The Amazonian shamanic tradition of using ayahuasca to treat psychological trauma is now being studied seriously in clinical settings. The ancient healers did not understand the pharmacology, but they understood the outcome. They knew which plants could reach a person who was otherwise unreachable, and they used them systematically. Community response. In small hunter-gatherer groups, the response to mental illness was almost always collective. The person was not isolated or removed. They were watched, tended to, talked to, fed, kept within the group. Someone always knew where they were. Someone always stayed near. In many cultures, a person experiencing a severe episode was treated as temporarily absent. Their body was present, but their self was elsewhere. And the community's job was to keep the body safe until the self returned. This is a framework that modern psychiatry is only beginning to recognize as clinically valuable. The idea that severe mental illness is not a permanent state but a temporary dislocation, that the person is still there, just unreachable for now, is one of the most compassionate frameworks ever developed for understanding psychosis. The dark side. Not all responses were compassionate. In some cultures, severe or persistent mental illness, particularly when it involved violence or behavior that endangered the group, was interpreted as permanent possession by a hostile force. When the healer's interventions failed, when the rituals produced no change, when the person continued to be dangerous or completely unresponsive over months and years, the conclusion was sometimes that the person who had lived there was simply gone. What remained was something else wearing their face. And what happened then depended entirely on the culture, the resources available, and the specific nature of the threat: abandonment, exile. In the darkest cases, something worse. These were not casual decisions. They were agonizing ones, made by people who had loved this person and could not reach them anymore, who had no other framework to understand what had happened and no other tools to respond. Here is the part of the story that should genuinely shock you. Because for all the demons and the skull drilling and the plant rituals, ancient culture stumbled onto something that modern psychiatry spent most of the 20th century getting catastrophically wrong. They kept people connected. The history of modern psychiatric treatment is, in significant part, a history of isolation. The asylum, the institution, the locked ward, the idea that the mentally ill should be separated from the rest of society for their own good, for society's protection, dominated Western medicine for centuries. We built enormous buildings specifically to put these people somewhere out of sight. We called it treatment. In retrospect, much of it was catastrophic. Ancient hunter-gatherer communities did the opposite. They kept the person in the group. They maintained relationship with them even when that relationship was profoundly difficult. They talked to them even when the person couldn't respond coherently. They fed them and sheltered them and watched over them as a collective responsibility. This turns out to be, by every measure modern psychiatry has developed, significantly better for outcomes in severe mental illness than isolation. Social connection, maintained relationship, continued inclusion in a community, these are not nice extras. They are core treatment components. The ancient world got this right not because they understood neuroscience, but because they had no other option. You couldn't put someone in an institution if there were no institutions. You couldn't isolate someone if your survival depended on everyone staying together. The limitation became the cure. The necessity became the therapy. Here is where we land. For the entirety of human history before the last century or so, every person who ever experienced a mental health crisis did so without a diagnosis, without medication, without a therapist, without any of the infrastructure that modern people assume is the minimum necessary response. What they had instead was a framework, however wrong the specific details, that said, something has happened to this person. They are not broken. They are not gone. Something has come in that shouldn't be here, or something has been taken that should come back, and our job is to try to bring them back. That framework was wrong about the mechanisms. It blamed spirits instead of neurotransmitters. It prescribed rituals instead of medications. It drilled holes in skulls instead of writing prescriptions. But it was right about something more fundamental. It was right that the person was still there. It was right that the community owed them a response. It was right that altered states of consciousness can be a pathway through psychological darkness rather than just a symptom of it. It was right that connection, sustained, patient, unconditional connection, is one of the most powerful healing forces available to human beings. We figured out the neuroscience, we built the institutions, we synthesized the medications, and somewhere along the way, for a very long time, we forgot the part they got right. That's all for today. Please donate or subscribe to fund the next video.